Welcome to YARKUD International. Let's start our today's section. So, reasons how the Prometric exam question and answer discussion here. Let's see first question. The client arrives in the emergency room after sustaining a chemical eye injury from a splash of battery acid. The initial nursing action is to options A. Begin visual acuity testing. Option B. Irrigate the eye with a sterile normal saline. Option C. Swab the eye with the antibiotic ointment. And last option will be the cover the eye with the pressure patch. Okay, so what you should be do? Okay, so here you have to remember always that is a splash injury, chemical injury. First action will be what? To remove the chemical, what we will do? If it is ingestion of something, we'll do the gastric levers, right? So now it is in the eye. What we will do first? Irrigate the eye with the sterile normal saline. Got the point? Never cover the eye with the pressure patches and all. Okay, so the antibiotic ointment directly swab in the eye? No. Okay, so visual acuity testing, it is not right time to do because there is a chemical inside. Okay, so what will be the answer? Answer is C. Okay, irrigate the eye with the sterile normal saline. So key point, remember, chemical eye injuries happen, the splash happens. So what we have to do? Irrigate the eye with the sterile normal saline. We have to wash out first. Okay, got the point? So let's see the second question. A male client is admitted for the treatment of the syndrome of inappropriate antidiuretic hormone. Which nursing intervention is appropriate? So here are the options. Infusing IV fluids rapidly as ordered, encouraging increased oral intake, restriction of fluids, administering glucose containing IV fluids at all. If you know what is it, you can able to answer it. Actually, there is a problem in the antidiuretic hormones. Okay, see here, always remember this too because there is two different condition. Okay, diabetes insipidus and the Siddha mean it is the inappropriate syndrome of the antidiuretic hormone. Okay, so this two condition is opposite. So always remember the Siddha, there is body fully soaked inside the water. It will be fluid retention, no urination at all. Okay, there is full body edematous. If you see full body edematous increase, BP will be there. There is a high chance to seizure and the patient will be died. Okay, so it will be the very dangerous condition. So here the Siddha, see the picture, it is full of water. How can you give water more? Okay, if we cannot infuse no IV fluids for the Siddha patient. If your doctor written, you have to counter check with the doctor. Okay, so we hear the answer is C, restricting fluid. Okay, so is it the always there is a restriction of fluid because already there is so much fluid inside not coming out. Got the point? Okay, this about the second question. Answer is C. Let's see the next one. The nurse is assessing an infant with the gastroesophageal reflux disease to help identify any complication of GERD. Okay, that is a gastroesophageal reflux disease. What is the most important question the nurse should ask the infant parents? Okay, so this is about the infant. So to assess the complication, what the nurse should ask to the parents. Okay, first one. Option A is frequency of respiratory tract infection. Option B is frequency of vomiting. Option C, time between bowel movement. Option D, time between feeds. Okay, so if you know what is gastroesophageal reflux disease, you can easily answer. That is the regurgitation of food contents. Okay, so whatever you're eating, it is returning, coming up. Okay, so what will be happen? There is a high chance of babies with the infant with the respiratory infection because the content is coming back. So there is a chance of aspiration. Whatever the content contaminator, whatever incident will go back and aspirate, it will be chance to go into the lungs. Okay, the patient, because of that, the infant will get frequent respiratory tract infection. Okay, so we are assessing the complication. It's not about the bowel movement, it won't come. time between feeds also, it is not assessing the, it is a treatment, okay? It is not assessing the complication. So it is here, the frequency of vomiting also not come. There is a complication called, there is a respiratory tract infection because a regurgitation, aspiration happened. Got the point? So what will be the answer? Frequency of respiratory tract infection, option A. Okay. So this is about the third question. Let's see the next one. Nurse is assisting a patient to ambulate in hall. The patient has a history of coronary artery disease and had coronary artery bypass graft surgery 3 days ago. The patient reports chest pain rated 3 on a scale of 0 to 10. We know the pain scale, right? So there is a pain rate now 3. The nurse should first, what the nurse should do. Okay, all the questions are, what is the care will provide? What is the nursing priority? What will be the nurse do first? Okay, so this type of questions are more common. Okay, you have to be remember all the thing you have to do. All the 4 action you have to do. But you have to select the what is the first. Got the point? Okay, we'll see the options one by one. Option A, determine how long it has been since the patient lost dose of aspirin. Second thing, obtain a chair for the patient to sit down. Okay, so long has been since patient last dose of aspirin, we have to check right because the medication. Obtain the chair to sit the patient, that is also right. Assess the patient radial pulse and assess the patient to take several slow deep breaths. Okay, so this all seems to be the answer, right? But what will be the best answer? Now the patient is complaining with chest pain. Okay, while which while ambulating time, that means walking time. Okay, so we know that actions will be increase the pain intensity. Okay, so first step, what you have to do, you have to be reduce the pain, you have to be control the pain, you have to be stop the patient. So obtain a chair for the patient, sit down, just relax, first step. Okay, then only you have to move on to the next step when the aspirin given lost. Okay, so this and all the next steps. First step, ambulating the patient. So patient should be sit down first. Okay, got the point? So first step, it is option B. Obtain a chair for the patient to sit down. Okay, let's see the next question. A patient presented with a high fever, headache, vomiting, neck stiffness for the past 3 days. Which of the following is the first diagnostic intervention for the patient? Okay. So if you know the symptom, according to that, if you find out the what disease condition, you will be able to answer it. So here the option C, urine and stool analysis is lumbar puncture with the CSF aspiration, complete blood count, chest and abdominal X-ray. So here they are just asking first diagnostic intervention. So there is a vomiting, high fever, headache, neck stiffness. Okay. So what will be the diagnosis will be? There will be the chance of meningitis. Okay. There is a inflammation in the meninges layer. So it is about the meningitis. So what is the test to do that for the meningitis? It is lumbar puncture with the CSF aspiration. Got the point? The answer is lumbar puncture to find out the meningitis with the CSF aspiration. Okay, this is about the meningitis. So let's see the next video with the more questions. So here the YARKUD International, we are giving the online training for all nursing examination like Prometric, SNP, Oman Pearson View nursing examination, MOH, DHA, HAD, OET and IELTS.